Okay, so you've had ACL surgery. Now what? What happens after ACL surgery? What's the recovery like? How long does it take to get back to getting back to do what you want to do, your normal daily activities, your job? And for most people who get ACL reconstructions or ACL repairs, it's when can I get back playing my sport again? This is Dr. P. We're talking about knees. Remember, if you got a problem with your knee, call Dr. P. So, yes, you'll be on crutches initially. You'll start therapy the next day, and what does the therapy do? No, they're not going to make you do squats on day one, but the number one thing to worry about on day one is no matter what surgery it is, there's going to be some pain, no doubt about it. So they're going to help with your pain. They're going to help get the swelling down, because swelling, A, causes pain, B, it decreases range of motion. And so swelling can also affect healing, the incisions from healing, etc. So they want to get that swelling down, and then we work on range of motion. Now with an ACL reconstruction, we're going to want to get that range of motion back as fast as possible. There's really no limits on it. Whereas with the bare surgery or the repair, we're going to limit it initially because we don't want to put too much stress. Basically, there's a scab in between those two torn ends of the ligament. And you know what happens if you keep picking at a scab, it's not going to heal. So until the ligament heals across that scab or that bridge, which takes about 6-8 weeks, we're going to have some restrictions on range of motion. The first 2 weeks, it's going to be anywhere from either 0 to 30 degrees or 0 to 40 or 45 degrees, depending on the therapist you go to. After the first 2 weeks, it's going to go from up to 45 degrees to even 90, bending it at a right angle. By the time you get to 7 or 8 weeks out from the repair surgery, usually we want about 110 degrees of flexion. Once you get to 110 degrees, then we can switch you to a more functional brace like the one you see the football players wear on TV. Again, with the ACL reconstruction, flipping back over to that, we're going to work on range of motion right off the bat. But both surgeries, the therapist is going to try to get the swelling down, get the range of motion back, and do exercises, a lot of times just like isometric exercises, which are things where you're just maybe squeezing the muscle, but you're not moving the joint. You're just squeezing your butt cheek, squeezing your quad, squeezing your calf muscles, moving your ankles up and down, things that aren't going to put too much stress on that joint. If you have any questions or comments, please feel free to put those in the comment section. We'd like a thumbs up if you can give us that, and please subscribe to our channel. And we look forward to giving you more educational videos, and stay tuned.